Hello, I'm Dr. Harvey Payne with Divine Mercy University, and I'd like to talk to parents to help their children and teens about the coronavirus, COVID-19. I'd like us all just to take a deep breath and focus on what's most important during this time of significant stress, in which it would not be unusual at all to feel anxious and worried. We are in a time of uncertainty in which there's information that we wish we knew, and the information we have seems to be changing on almost a daily basis. I'm sure that all of us as individuals, families, and communities have been in somewhat similar situations in which we have faced times that have caused stress, anxiety, and worries. God's gifts to all of humanity, reason, science, faith, and our lived experience, and especially the help and support of family, friends, and our local communities, has helped us in the past and will continue to help us today. I think perhaps the most important factor is that we are in this together, and especially as families, whether you are in one location or spread across the country or even the globe, being connected and supporting each other as a key factor in getting through this situation. And so I'd like to talk about some ways that we can help each other during this time. So first really is breathing and calming ourselves and having a sense that even in such a difficult time, we can move through this. You know, how we respond has a definite connection to how our children and teens respond to this difficult time. Next is to listen. Listen to your children and teens. As parents, we have a tendency to tell our children and teens instead of listening. This is a time to listen and ask them what they've heard about the coronavirus or COVID-19. Ask them about their thoughts and feelings about what is happening and how's it going for them, their classmates and friends. Ask if they have any concerns, especially about themselves, their friends, family, and extended family. Allow them space to express their fears and concerns. Answer their questions as calmly and accurately as you can at their developmental level, and answer only their specific questions. If they have questions you cannot answer, it's okay to say, I don't know, especially in the areas we do not know. You can also say, I don't know, but I'll see if I can find out. For younger children, I would encourage you to find the information without them and then share it in an age-appropriate way. For older children and teens, I would look together at reliable sites such as the CDC, Centers for Disease Control and Prevention, and your state health department. The good news is that for most children and teens, if they contact the COVID-19, it will be mild and not a significant health risk, unless the child has an underlying chronic medical condition that impairs their immune system. I would suggest having this talk during a typical activity, such as coloring with your younger children, playing with older children with their common playthings, or taking a walk, or doing chores with teens. Do it as part of your everyday life. Part of helping children and teens is maintaining regular routines as much as possible, even in the midst of changes such as school closings. The more one is able to maintain the normal structures of life, the more secure children and teens will feel. And remember, this checking in and listening is not a one-time event, but an ongoing conversation. Also, talk about what you are doing to stay healthy and what they can do. Engaging children and teens in positive, healthy activities, plus the recommended preventive activity, such as washing hands with a song or a rhyme, or doing the alligator cough, provides a sense of positive control over what is happening in ways they can care for themselves and others. Not touching one's face is extremely hard to do, even for adults. Providing and redirecting children and teens to another behavior is often more helpful than saying, "Stop touching your face." This could be put your hands in your pockets, touch your elbow, or hold your hands for 5 seconds. For screen time, I would encourage you to limit the amount of screen time for yourself, your children, and teens, especially around the issues of the coronavirus. We know repeated exposure to anxious producing material can in fact increase needless anxiety and worries. It's not helpful to have the news on 24 hours a day. However, I would encourage contact with your family members who are not local by using video platforms and other technology that allow children and teens to see their extended family to really know they are okay. Also, know that your children and teens may have more difficult behaviors due to the stress of the current situation. Just think of how we as adults have probably not been our best selves during this time, with the added stress and frustration of this time. Infants may become more grouchy, crying more, needing more physical and emotional holding. Younger children may return to behaviors they've outgrown, wanting a pacifier, their blankie, bedwetting, or even being more frightened about being separated from their parents. They may also have tantrums or a hard time sleeping. Older children and teens may feel their emotions more intensely and express it physically rather than verbally. They may overly focus on certain details, talk all the time, or refuse to talk. They may be more impulsive in their behaviors. They may argue more with friends, siblings, and parents. Allow them to express their feelings, even if intense, and show understanding and that you often feel the same way. Let them express their feelings and then redirect them to positive activities of their normal routine. Breathe deep and remain calm. This is really important, and it's important to know that we will get through this. And regardless of what happens, the thing that will remain the most with our families is how we loved and supported each other, how we did not blame others for what is happening, but instead looked at positive ways to cope with this difficult situation. God's blessings as we all walk through this difficult time, and hopefully a time where we can join together and really support each other.